If you plan to spend any time at one of Rhode Island's many beautiful beaches anytime in the next couple of months, it's probably a good idea to first check with the Rhode Island Health Department to see if any beaches have been closed to swimming due to high bacteria levels in the water. We try to announce the department's beach closure notices each morning on the Sunrise News and here on the Noon News. Ernest Julian is with the Health Department, and he joins us now to explain how state inspectors decide on whether it's necessary to ban swimming, where and when. For example, we know that Oakland Beach and Kennemicut Point Beach in Warwick are closed to swimming today because of the high bacteria levels.
Right.
How do you make this determination?
We review over about 2,500 samples every summer, and when we get high bacteria counts, the beach ends up closing.
Now, some of these beaches are inspected more often than others, correct?
Absolutely.
How do you determine which ones to inspect more frequently?
We look at past history, what beaches have had high samples. We also look at what's nearby. Are there any sources of contamination nearby? There are also some beaches that close just when we have a lot of rain. We have an inch of rain and a couple of beaches will close based on previous history.
And you're talking about based on things next to the beach. For example, I know
Right.
Warrentown Beach,
Right.
The treatment plant is right next door.
Right, and they had problems with the sewer line there also.
Yeah, now that hasn't been closed yet this year, but it happens sometimes in
Right.
Warren.
So number one criteria is protecting public health, but we also don't want to close beaches needlessly. So we look at the history, we look at the bacterial sample, we look at what's nearby. We spend a lot of time working with DEM, Department of Transportation, and the towns to find and eliminate the sources of contamination.
On July 4th, Go Local Prov released a report from a national agency that criticized Rhode Island in terms of it being 25th out of 30 states with beaches for water quality problems. You're a little critical of that designation, are you not?
It's not accurate. It really isn't, because we test our problem beaches much more often. There were some problem beaches we tested almost 100 times last year. Good beaches might be tested twice a month. So you can't compare an average of us testing our problem beaches much more often with states testing them all at the same frequency.
Yeah, they did issue a list of the beaches with the highest percentage of beach closures last year. The two Warwick beaches that are closed now are on the list, along with Fogland Beach in Tiverton, Hazard Beach in Newport, Scarborough South, which is a big draw in the summertime. You don't want that one to be close to swimming if you can help it.
Right. We've had problems at a lot of beaches with storm drains and also with waterfowl at some beaches. So different beaches have different sources of contamination. And what we do is look to find the source of contamination and eliminate it. The good thing is in 2003 we had 16 inches of rain. We had 20 inches of rain last year. We had a quarter of the closure days last year as 10 years ago. So we're finding and eliminating the sources of contamination, working with DEM and the towns and Department of Transportation.
And we thank you for joining us to explain that. Ernest Julian from the Health Department.
You're welcome.